Okay, we are heading back to the TV studios at Hartford Hospital right now, where Laurie St. is standing by to talk with us. A nurse by training, Laurie is the vice president at Hartford Healthcare at Home. We are talking to her about the senior population and the risk factors for them when it comes to the coronavirus. Thank you so much for being with us.
Thank you for having me.
So anyone over the age of 60 years old is being told, stay home. Why is that?
Well, people over the age of 60 are higher risk for getting the COVID-19 with complications. They can certainly take measures to protect themselves just like everyone else, but they are at higher risk.
For those with family members who are in nursing homes, this has been a very challenging time. There are major restrictions, rightfully so, with safety being the priority. But why is it so important that kids and grandkids are not going to see their parents and grandparents in these assisted living facilities or nursing homes?
Well, we know that with the COVID-19 that social distancing is very important. So to protect our seniors in nursing homes, we really don't want them exposed to a lot of people, especially children. I mean, as grandparents, we all love our grandkids, but this is probably not the time to be visiting with grandchildren.
Yeah, there has been a lot of FaceTiming, or we've seen those pictures go viral of them outside the window where their family member is. And it's it's beautiful to see, but heartbreaking at the same time to know that they can't be together. I wanted to ask you, obviously, age is just a number, but there are 80-year-olds who are in great health and some 80-year-olds who may not be in such great health. And how does that affect getting the virus and the symptoms and outcome that they may have?
Well, certainly anyone over the age of 60 is at higher risk, but if you have comorbidities like diabetes, heart disease, you'll have even a greater risk for complications from COVID-19. But a person who's healthy, 70, 80-year-old, if you have good nutrition, you use good hand washing, you continue to exercise, not at the gym, you can take precautions to limit your risk. Again, social distancing, avoid crowds, keep 6 feet from people, and that should help protect you.
We've been getting calls from a lot of viewers who say they are over 60 and they are still taking a trip. They say they've got by this far and it's not going to stop them. What do you say to them?
Well, I think it's not just their risk, and they are at a greater risk, but it's the risk that you pose to other people. Taking public transportation, flying, you are going to be exposed to a lot of germs. So it's probably not wise to do that now.
Yeah, that makes a lot of sense. We do have a viewer question that I want to get to. This is from Barbara. She is saying, and this is a big question on a lot of seniors' minds, is it safe to go in a grocery store? I'm 60 with medical conditions. If I go and they open the doors to seniors and there are 20 people or more, is that safe?
I think that if you go to the grocery store and, again, social distancing, you keep a social distance from the other people, you should be okay. Most grocery stores, at least mine, has this the wipes, the sanitary wipes that you can use. I would use those. I'd use them on the carriage. But there are other ways to get your groceries. Certainly you can order. Many grocery stores allow you to order. That would probably be the safer option, but I think that you can take precautions if you do use the grocery store.
What's the biggest thing seniors should know in terms of if they start to feel unwell? Should they go to the doctor right away? How should they handle this situation?
They should definitely call their doctor. Their doctor will advise them what to do. They may not advise them to come into the office, but they will certainly tell them what medical measures that they should take.
Also thinking about things that seniors can do. We've been talking about, getting outside and getting some fresh air. I would assume that that would be something that is acceptable for them to do. What are some other options for them to socialize and interact?
Well, I think that we do have concerns about social isolation, so seniors should really do what they love to do, whether it's reading, whether it's watching movies, Skyping or FaceTiming with your grandchildren, listening to music, staying current by watching TV. I think there are lots of things you can do, but it is a concern that the isolation that they may feel.
We've been asking for, or we may ask for, some retired nurses to come back into the workforce. Is that a concern given the fact that obviously they're retired, so you have to assume that many of them are above the age of 60, and now they are going, you know, right into the lion's den, so to speak?
Yeah, well, I think that the retired nurses that do come back, and you know, kudos to them, they would probably not be patient facing. I think there are lots of things that they could do. They can do chart audits, they can do things behind the scene, they could even do things from their home. So I think that they definitely bring value, especially now that we are seeing a shortage because of the illness.
And lastly, Laurie, I wanted to ask you, how are the doctors and nurses holding up? I know this is a stressful time for all of us, but they are obviously on the front lines.
I mean, I'm so proud of all the clinicians in Connecticut, the clinicians at Hartford Healthcare. I think there is some anxiety, of course there is, but they're still out there, they're working, they're taking precautions. Just really proud of the response that we've had in Connecticut from our clinicians.
Well, thank you so much, Laurie St. John, for being with us. Thank you to Hartford Healthcare and all of the healthcare professionals working tirelessly all across the state. We couldn't do it without you, that's for sure.
Well, thank you so much for having me.